So today on Beyond Scaling, I'm joined by Lucien Morin, CEO of Savvos Health. Savvos is taking on something most of us have felt the weight of, especially in the US, of course. The frustration, the confusion, and the endless paperwork of US healthcare payments. Lucien's company is replacing the old model of claims with something far simpler, which is immediate cash payments, upfront pricing, and a direct line between patients, providers, and payers. But behind the technology, there's a deeper story, Lucian. I think it's fair to say. How you set out to fix a legacy business model that's been around for decades, and what it takes to align stakeholders who've been embedded in that process for decades. It sounds like no easy feat.
No, oh yeah, well, yeah, I think you said it perfectly, right? And in fact, as we were getting to know each other here at the start, I kind of alluded to that fact that when we started building Savvos, I don't think we quite realized just what a project it was going to be, right? And certainly there, I think there's a lot of reasons for that. I think we're kind of entrenched in a very specific way to engage in the business of healthcare in the U.S., where we're a heavily regulated industry. And so you've kind of got, a lot of things working against you, some pretty stiff headwinds when you're trying to push some serious change in healthcare in the U.S.
Yeah, it takes a lot of courage to take on that system, Lucian, I'm sure. But before we get into the business, I want to just think back to the early years. You moved from Maine to Utah. Outside of business, what's the moment that really shaped who you are as a leader today?
Oh, that's a great question. And I don't know if there's a singular moment in time as much as just how life evolves. And I think your perspective matures as the years go on. I mean, I look back to my days. You mentioned I left the East Coast. I grew up in the state of Maine and went to college in Utah and fell in love with the West and decided that I wasn't going to leave. And I think one of the things that really became the foundation of my business career was really just the kind of the entrepreneurial feel of the West Coast in the US,
Okay.
right? When I was a young man coming from New England, that really wasn't the case in Maine, New Hampshire, Vermont. There wasn't really this kind of this entrepreneurial mindset. But when I showed up in Utah and started going to school here, you could feel it. I mean, it was a very different approach to life, to business. And I really just kind of caught fire with this whole, like, let's go out there and find a way to build something. Let's go out there and try to fix something. Let's find a problem, work on it. And that kind of that culture, and you feel it in the West, right? Like
Yeah.
all these Western states. And anyway, I think that combined with a great, degree from, where I went to college, and that just kind of became this foundation where I just kind of built on that.
Yeah, it's interesting, isn't it? The environment you're in, the environment you find yourself in, or in your case, the environment you've placed yourself in. It can be such a positive thing or a negative thing, right? It's infectious. If you're around that kind of environment where people are getting after it, so to speak, you get caught up in it, and it'll really bring the best out of you. And likewise, if you stay somewhere where it's more subdued, and then you can go the other direction, I suppose. So it sounds like you found your people there in Utah.
We connected. I remember when I was 18 calling my parents as a freshman in college and telling them, look, I love you guys, but I'm never coming home. I mean, like this is where I was meant to be. And, I think, developing this kind of this culture that, opportunities are endless and you can see them around every corner. And there's just, you can be a part of solutions, right? And that's kind of, you feel that all through the Western states. And certainly, like, Utah has really matured that over the years with Silicon Slopes and such a tech environment here in the state of Utah. It wasn't as organized 35 years ago, but it's
Sure.
certainly kind of grown and accelerated over the last couple of decades. And so it's just a great place to engage in your business career out here.
Yeah, it sounds it. It sounds it. I can feel the energy. I know you still love it today, 35 years on, which is great. So listen, I think before we really get into this, what you've got going on there with Savvos, it isn't your average business, right? You're trying to break the mold with a highly innovative approach to what we can only describe as quite an antiquated process. I think you've even described it yourself as a dumpster fire, which made me smile. And honestly, I think anyone that's had exposure to healthcare claims would likely agree with you. So let's start there. What is Savvos? What is Savvos? And what is it doing to revolutionize this broken system?
Yeah, great question. I mean, ultimately, we are a digital healthcare company, but really the mission of Savvos is we want to create a modern business transaction in the healthcare space. And what I mean by that, and you stop me, Lloyd, if I just get too lengthy in this answer,
No, you go ahead.
It's interesting if you look at the U.S. healthcare system in terms of access to care and quality providers and wonderful physicians. I mean, the United States has some of the best in the world, right? I mean, some of the best doctors, some of the best health systems. And if that's the case, why is the transaction always a complete disaster, right? Like when you look at healthcare in the United States, I think the word that describes it the best is misalignment. Like when you look at the stakeholders in a healthcare transaction, whether it's the consumer, oftentimes the employers involved, most people in the U.S. get their health care through their employer. I mean, there's this connection there. And then you look at the providers, whether it's a hospital system or maybe it's a private enterprise like a physician-owned hospital or a surgical center or what have you. But boy, when they come together and try to transact, it's a disaster. Or like you quoted me, it's a dumpster fire, right? And what's interesting is in the United States, everybody's talking about all these different solutions, right? Like we need transparency, we need, we need, whatever. I mean, the list goes on and on. But oftentimes we kind of dance around the issue and nobody's really focusing on, well, what's the core part of the problem? Why is there so much frustration between all of these stakeholders in the transaction? And the whole idea behind Savvos is we believe that at the center of almost all of these problems, whether it's opaque pricing, out of control costs, terrible experience, general frustration across the board, at the center of almost all these problems is a very outdated business model in healthcare. It's this idea of post-care claims processing, right? So in the United States, you show up for a medical procedure. Let's say you're having a surgery and you pull out of your wallet this ID card and you hand it to that provider. And it starts this journey of this complex process of submitting a claim somewhere, right? Like in the United States, consumers and their health plan and providers, they never transact directly. They always transact through some third-party entity. Usually it's a network, but it could be some kind of variation of that, a unique direct contract or some kind of a benchmark pricing model or whatever the case may be. But this idea that like we can't transact directly, we've got to submit the most complex claims processing paperwork to somebody else to figure out what that medical procedure should be priced at. Lloyd, it's the worst business model, period, ever. I mean, it's got to be the worst idea that has ever been invented. And the reality is when you look at the inefficiencies that this outdated model creates in healthcare, it's at the center of not only a terrible experience, it's at the center of struggling medical providers. It's at the center of the number one reason why we declare bankruptcy in the United States. It's at the center of so much bloat, so much inefficiency. Lloyd, in 2023, the United States spent $5 trillion on healthcare. But do you realize that out of that $5 trillion, only about $1 trillion actually went to your providers, your surgeon, your primary care doctor? So if only 20% of those funds are actually hitting the front end caregiver, where's the other 80% going? Now, certainly there's some fixed costs, and maybe there's, facility fees, or, you've got, there's some other legitimate costs in there.
Sure.
But the reality is the vast majority of that 80%, Lloyd, it's lost in this bloat. It's lost in this inefficiency. It's lost in this, like, the worst business model that's ever been invented on the face of the planet. This idea that when I show up and I engage with a medical provider, we just can't have a transaction between the two of us, or between me and that provider and my health plan, that's simple, that's transparent, that's engaging. So when you look at so many of the problems in the US healthcare system today, I promise you, we're trying to get a handle on out of control costs. We're trying to control health insurance premiums. We're trying to increase the level of benefits that consumers have access to. We're trying to create a better experience for consumers, for their health plans, for their employers, for providers. When you look at all these problems, at the center of almost all of them is a very outdated business model. We live, and some of it's really not anybody's fault, right? Healthcare is one of the most highly regulated industries in the United States. And I think highly regulated industries really struggle to innovate. Look at it in US banking, and look at it in other sectors.
Global banking. Yeah, global banking.
Global banking, right? So you get into a lot of hurdles that everybody just kind of starts to settle for the norm. But here's the issue in the US healthcare system today. Consumers have been frustrated for a long time, and their employers have been frustrated for a long time. But today, you now have tremendous frustration on the supply side. You've got hospital systems, surgery centers, providers, your physicians, your surgeons. They all are sick and tired of this business model, right? Because they can't collect their money, revenues. Do you realize in the United States, we have an industry called revenue cycle management, right? It's the business of helping providers collect their money from third-party payers, like insurance companies or what have you. Do you realize over the next 10 years, the industry of revenue cycle management is projected to grow to about $500 billion? So, just chew on that for a minute, right? Like, the business of just trying to collect your money in healthcare is almost $500 billion industry. So
and we can't really put in that. We can't really imagine $500 billion, right? We can say that word trillion, but to really put your finger on what $1 trillion is, I can't imagine it. My brain.
It's ridiculous. Like, we talk about these numbers. We spent over $5 trillion in healthcare between, federal programs, state programs, commercial insurance, private insurance. But $5 trillion, you can't even fathom how big of a number that is, right? Like it's just a massive industry, but it's filled with so much bloat, so much inefficiency. So back to your original question, well, what is Savvos? Well, Savvos is a digital healthcare solution that builds direct digital connections between health plans and their members and the medical providers in their local community. The whole mission of Savvos is we want to make claims processing, an outdated business model, a thing of the past, right? So how does Savvos change the transaction, right? Well, instead of a consumer and their health plan trying to do business the old-fashioned way, we build these direct digital payment rails between these stakeholders. So now, let's say, Lloyd, you need a shoulder surgery. Well, our tech connects you immediately with local providers in your market, and we build this platform of immediate conversation between everybody. So you can just get in there and say, hey, look, I'm working on my procedure. Here, let me sync up my doctor. His office will be in there. Yeah, we had the consult. We did the imaging. Here's my orders for the surgery, right? And they'll upload them into our tech. Anyway, my point is everybody's just talking to each other within our platform. And what that allows is that provider can look at the details of that case and say, all right, I'm going to lock down my price right now. We're going to go ahead and do this shoulder surgery for $10,500. The health plan. And so what usually takes weeks and weeks to try to figure all this out, by building these direct digital connections, we can schedule and determine the need of care in a matter of like minutes or hours or days, right? So not only do we simplify the whole transaction, but our tech ensures that these providers get paid immediately. Lloyd, if you were running a local hospital and you plug into our tech, you know with confidence that as soon as you deliver care, the money's available. Like you're paid immediately. So we eliminate all the complex billing, revenue cycle management. We eliminate collections, appeals, denials. We eliminate all the hassle of getting paid. And when we do that, those providers are able to offer, there's just a competitive direct pay price. We call it cash settlement, but the reality is we bring cash pay at scale to a third-party payer environment. But the idea is let's build direct settlements relationships that are immediate and simple. So in some markets where that shoulder surgery would have been a $30 or $40 or $50,000 bill, we're doing it for $8,000 or $10,000 or $12,000 because we simplify the transaction and we guarantee immediate payment. So think about how that reverberates across all of the stakeholders. By simplifying the transaction for providers, we reduce the spend in the health plan dramatically. In most markets, by more than 50%. The end result to the employee is all of their out-of-pocket costs are waived completely in the transaction. So before, that employee might have had to meet a $5,000 deductible, and so now, because they're engaging through the Savvos tech, that their health plan saving enough money where we can waive the out-of-pocket cost for the employee, settle directly with the provider, everybody wins. So that's ultimately the idea behind Savvos.
That's beautiful. And excuse me when I say this, it's not wildly complicated, Lucien. What you've just described there seems to me like a very logical way to deal with the problem in this day and age where we have the technology. I'm sure the way you've described it there for the layman like myself is straightforward, and I'm sure there's a lot of tech behind what you've done. And I'm sure that all of that, if we went into that, you'd lose me quickly. But the concept of what you've just described, it's a no-brainer, right? The only area that I can see from you speaking there, I mean, I don't want to put my tinfoil hat on here, but there's many trillions of dollars going into somebody's pocket somewhere along the line. And if they're earning that much money, they've obviously got a large influence over the industry, and they're not going to want to give up the cash cow, right? Are these some of the blockers that you're seeing? Are you seeing blockers even in this area?
Well, oftentimes it depends on a couple things. It depends on the market that we're in, and it depends on kind of who's in that market, right? Like if you've got an integrated health system where the hospital owns the health plan and they kind of control the market, that's a very different story than other markets where there's a lot more competition and what have you. But back to your earlier point where you talk about, this is a really simple idea, right? But if you bring like cash pay in the self-pay environment is a very simple transaction, right? Like if I don't have insurance and I show up for a medical procedure and I say, look, I'm just going to pay you right now. Give me a great price. Here's my credit card. That's a pretty simple transaction. Savvos, we are cash pay in a third-party payer environment. So what you need to understand is if you're trying to bring not just a consumer to the table, but you're trying to bring a health plan to the table, then the idea is simple, but the transaction is very complicated because you've got to integrate with the health plan. You've got to make amendments to their health plan documents. You've got to integrate reporting with their administrators and their stop loss insurance. You've got to you've got structure that has to happen on the product side to ensure that you can deliver direct settlement solutions to these providers, right? And so when you look at the ability to bring those stakeholders together, that's the real value of Savvos. Everybody in the United States talks about what we need is transparency in the data. And the reality is with AI and everything that's, with everything that's happening in the, in the tech world today, that problem is going to be solved in no time. It's not about transparency in the data. What we need in healthcare is transparency in the transaction. Yeah. We need to build a payment rail that brings the stakeholders together and aligns the incentives of the provider, the consumer, and the health plan, and creates a successful transaction. Because you might know as a health plan, oh, well, if my employee goes over to that facility, we can get a way better price. But how are you going to do that if your payment rails are built around a network? How are you going to do that if your plan design is built around an outdated payment model, right? Like, you can't transact in conflict with the way your health plan is built. So that's why Savvos is having such success, is because we go in and we've built the technology payment rails that build these digital connections that fully align with the parameters of the health plan to create a successful transaction and allow for a better business model that actually works.
Yeah, and understanding upfront what you're walking into, because these bills, better than anybody, right? These bills can run into tens, if not hundreds of thousands of dollars, right? So knowing what you're walking into, you know, as a patient walking in there, or as an employer who's covering your employees' healthcare, understanding what that's going to be up front, it removes any possibility of price manipulation or inflation. As you said, bloated system. I think it's a very clever idea that you've got, and it, for me, there doesn't seem to be any downside. How are providers and payers reacting to the idea of immediate cash payments and direct communication through Savvos Connect?
Yeah, and to your point, there really isn't a lot of downside. So, and the other thing I would just elaborate a little bit is
Yeah, please.
when you look at the market today, right? Like, when it comes to controlling cost in healthcare, most of the abuse on the billing side is at the facility level, right? It might be a local hospital that's, the billing is just egregious or what have you. But where we tend to focus on in the US is we're beating up the provider, like that independent surgeon that's doing the ACL repair. He's getting paid less and less and less, while that facility is taking more and more and more. And so the transaction's gotten way out of balance, right? So, like, for example, like, I'll give you a great example. We had an orthopedic case with one of our clients that was in the Texas market, and that surgeon reached out to our office and said, "Look, the member made a mistake, and they were going to run this through their normal network." And he said something that was really telling. He said, "If we run this through the network, I get paid about $1,000." Well, through Savvos, that surgeon got paid $4,000, and we still saved the plan. We reduced the cost of that procedure by 50% by paying the surgeon what they're worth. Because in the United States, the crisis of out of control costs, it's a crisis in geography. It's where do you have the procedure, right? If you
Yeah.
end up at the wrong facility, they're going to bill $135,000 for a heart ablation that you could have 10 miles away for $35,000, right?
Wow.
So the volatility in pricing is really at the facility level. So when you talk about defending the independent practice, when you talk about supporting the entrepreneur, the surgeon who's running his own practice, who just started his own surgery center, these guys are the ones that are getting killed, while most of the abuse is kind of at the facility level, right? So with Savvos, we kind of tip the scales in favor of the private practice physician. We make sure that they're getting compensated as they should, while we bring down the spend in the plan. So the relationship is actually, like, really exciting. When we reach out to in these local markets, the health systems that push back are the ones that are, to be quite honest with you, just really entrenched in the local market. They've got their business model. They're able to build these commercial plans at these 3, 4, 500% of Medicare. Everybody's just kind of in lockstep with how that system's working. And, those are the markets that are difficult for us to move into. And so we, those states, I mean, they'll probably be some of the last states that we attack, but most states in the United States, there's tremendous opportunities for us to go in there and modernize these payment rails and bring tremendous affordability to the transaction.
Yeah, yeah, yeah. It sounds good, and I'm Yeah, I can't help but draw back to the amount of waste that this is going to solve, right, overnight. The amount of inefficiencies and waste that this is going to clear up. The providers are going to be better. The patients are going to get a better service, better pricing. It's hard for me to imagine where the rest of that money, where was that going, or where is that going today? No, is it the facilities, as you say? Are they the ones that are skimming so much off the top? Is that where the other 50% is going presently?
Well, you've got, I mean, certainly, I mean, let's just, call a spade a spade. There are a lot of bad actors in the US healthcare system. There is, in a lot of markets, there's tremendously abusive billing practices that are happening in the United States. And a lot of it really is the result of this old business model, this idea of like post care claims processing. Once
Yeah,
you've received care, and now you're trying to settle the bill, you have very little leverage left, right? I mean, there are some
yeah,
opportunities working with nonprofit health systems and whatnot, but the reality is by the time you fight it, it can ruin you financially, right? So,
yeah,
so when we bring, this front end engagement, so the whole idea behind Savos is we need to make post care claims pricing a thing of the past. We should be able to engage directly and before any care is delivered we should be able to know exactly what that procedure is going to cost. And the reality is that alone, Lloyd, we see it every day where, a member says, hey, I'm being told that, my hysterectomy is going to be 74,000 at this hospital. And we'll say, no, and they said, and it's typically 150, but they're going to discount it to me down to 72, right? And is that a good price? And we'll say, no, you could have that surgery for $7,500 at 3 phenomenal locations in your market, right? So when we're able to have these conversations up front, then we can filter out a lot of that nonsense, right? Um, but the other thing that I was going to mention was when you look at the overall experience between whether it's the employee and the health plan and the provider, we bring tremendous savings to the overall transaction. But the reality is the number one feedback we get from these consumers really centers around the experience, where they'll say, "Hey, guys, it was like that was just the best healthcare experience I ever had. It just felt like a normal transaction. I didn't spend the next 4 months of my life getting bills in the mail and spending 20 hours on the phone trying to figure out, well, what do I still owe and why do I still owe it? And back to your question, where's all this money going? Well, besides just kind of general billing practices that I think are unethical, there's just tremendous inefficiencies in that model. So you've got middlemen, you've got collection agencies, you've got billing practices, you've got revenue cycle management organizations, I mean, it's incredible how much money is being spent to support such an outdated business model, right? We could bring down the cost of care in the United States 30 to 50% by doing nothing but creating better efficiencies in our markets, right? We've got to save money on healthcare in the United States. When you look at what it is now in terms of a percentage of our GDP, I mean, it's just out of control. But the reality is if we just created more efficient markets, we could reduce that spend easily 40 to 50%, right? And the whole idea behind Savos is we've got to build a modern transaction in the space. There's a lot of great ideas in healthcare, whether it's, like reference-based pricing or direct contracting or whatever. There's a lot of really good solutions in the market, but Lloyd, they're all being implemented on an outdated business model, right? It's like, hey, here's this cool direct contracting idea. Instead of submitting your claims here, send them over here, right? Like it's like we're
mhm,
optimizing dysfunction in healthcare, and we need to stop doing that and just completely replace what is. It's like in healthcare, it's like we keep trying to build a better fax machine when nobody's faxing anymore. It's like,
it's a
guys,
trick
we need to
analogy.
stop transacting this way. Let's modernize the payment rails and we can get rid of all this ridiculous complex billing, all these HCFA forms, building all these 837 file feeds. It's immediate, it's simple, it's transparent. And as far as I'm concerned, Savvos has built the future of the healthcare business transaction.
It's hard to disagree. Hard to disagree entirely. Why do you think they keep patching this old system up instead of just replacing it? What do you think's holding them back? I know it's heavily, is the government getting behind this? Have you managed to kind of get in front of anybody in government to try and drum up some support from that side of things? I'm sure that's more difficult than it seems. There's a lot of healthcare, within lobbyists. Then, if you like, I know that. But is there any way you can get to kind of a higher level with this, Lucien?
Well, I think so. I hope so. I mean, certainly there's a lot of momentum, right? But here's my position, Lloyd, is I think good legislation always follows consumer sentiment, right? I think a consumer movement always leads to better regulatory changes. I mean, most of the problems we're dealing with in the US healthcare system today are they're the unintended consequences of state and federal regulation, right? So we push these ideas and we push, the Affordable Care Act. I mean, it's a pretty broad piece of legislation, right? But in summary, I think it was one of the worst things that happened to the US healthcare system. So many of the problems that we deal with today in terms of opaque pricing, out of control costs, these are a direct result of, the Affordable Care Act that was passed in March of 2010. We saw most of the provisions go into effect January 1st of 2014. And if you go look at just healthcare costs over the last 10 to 15 years, I mean, they've skyrocketed. And if you want to have that conversation, I can tell you exactly why the provisions of the ACA that have caused the problems that we're dealing with today. But the reality is I think consumer sentiment drives better legislation. So as we continue to push our tech, as we continue to kind of impact the markets, I do think good legislation will eventually follow. And certainly it's complex, right? Like in the United States, we fight for private enterprise. We push back hard against a single payer system, Medicare for all. Lloyd, we have over 70 million people in the United States on Medicaid, not to mention, I don't know the number off the top of my head, but there's got to be, I would guess, over 50 million people on Medicare for the elderly. I mean, the reality is the United States already supports the largest single payer system in the world, and so when you start trying to push for change in healthcare in the private sector, when you're also so heavily influenced by federal programs, Medicare, Medicaid, TRICARE, it's, I mean, certainly there's some bad actors, but there's a lot of good people trying to push change, but the headwinds are strong, man.
I'm sure. And there's a huge financial benefit for many people in strong positions. How do you get the word out? I think I agree. I agree with what you said there, with regards to, it's the voters that are gonna be able to drive change. Is there anything Savvos is able to do to, are you considering or working on a campaign to reach the masses? Because how much of this do you think is education and knowledge, right? Because I speak with insurance companies frequently, underwriters and agents and everybody else, and it's not the most exciting topic for most people. For your average Joe, right? It's not something that everyone feels the pain of it, and when it comes down to it, how many people out there do you feel are aware of this bloated system and are aware of how little is actually going towards their medical care? I'm sure you get a surprise, you get a lot of surprise faces when you're speaking to clients of yours directly.
Yeah, I mean, you get it, right? Like, it's a hard conversation to have. I mean, certainly there's a lot of frustration, but I mean, there's very few things in our lives that are as personal as healthcare, right?
Yeah.
I mean, when you look at like what are the two things that matter the most to people? What are the two areas in people's lives where they get the most emotionally charged. It's their finances and their healthcare. So these are not easy conversations to have, right? Especially, I mean, when you're talking about, like safety net programs for the underprivileged, like Medicaid. I mean,
Yeah.
anytime, like, this is taboo to even mess with it, right? You look at the current administration just trying to bring about what seems to be some very practical, updates to these programs, and the pushback is
Enormous.
dramatic, right?
Very
So,
vocal.
but if you're gonna talk about maybe changes to Medicare, well, not my grandma, right? Like, I mean, you're gonna mess with, my parents' retirement, their benefits, their health benefits in retirement, right? So these are very emotional conversations to have, and so we get it, right? The other complicating factor is, I mean, the U.S. healthcare system is so complex, right? Um, Fully insured health plans are regulated at the state level, right? So you can have a conversation with the federal government all you want, but but
Okay.
you've got your state insurance department is managing and regulating all your fully insured health plans. But if I'm in the state of Utah and I self-fund my health plan, well, that becomes an ERISA contract that's now governed at the federal level, right? So the complexities of trying to deal with healthcare through legislation, it's just not as easy as you think. It's just so complex, right?
I didn't think it was easy, Lucian. I certainly
Yeah.
didn't think it was easy. I think what you're taking on. I used the word at the beginning of the podcast, and I think it's courageous. I really do. I mean that. I think to take on a system like this, where there's so much at stake for many people, and with a solution that really could revolutionize the healthcare system for and 95% of people, if not more, are going to benefit from this, right? That's what it seems to me. If that number is not even higher, what do you think is what was the biggest gamble you've taken when you've set out on this journey to tackle such a complex and antiquated system?
Well, for us, my buddy Jake, him and I, we've had great careers. We've built other companies. We've had great exits, and um, but we sold our previous companies so we could start Savvos. And the biggest gamble was, I was almost 50, and I went to my wife and I was like, well, we're going to sell this company. Do you want to retire, or do you care if I risk everything on one more venture, right? So when, you talk about like sinking the ships in the harbor, we kind of we kind of went all in on this project, and it's actually been a really rewarding experience. But yeah, it wasn't without its risks, but it's I think any kind of a technology lift it's time consuming in healthcare. It's very capital intensive. But we've had great support. We have a great cap table, a great group of shareholders that have kind of come along with us and helped us along with this journey. And now we're having tremendous traction, right? But I mean, because when you look at, I mean, certainly we've got kind of the underprivileged, the poor and those that I think are taken care of through programs like Medicaid. And we certainly want to, we don't need to expand Medicaid to people that, are able-bodied and can work and what have you. But certainly we need to look out for those that, that need that extra help. And we take great care of our seniors with Medicare and what have you. But in the middle, the vast majority of these consumers, they're getting their insurance through their employer. And so that's the focus of Savvos, is like, we're going to start here. Like, we want to impact that commercial market and help employers and these good families get affordable, phenomenal health care, and do it in a manner that's just a reasonable, straightforward transaction.
Yeah, I picked up, Lucian, you've announced an immediate cash health payment plan for self-funded employers. Is that correct?
Yeah, so most of our work to date, we built some great products around our tech, and in the early days, we would take our tech and we would add it to an existing health plan, right? Like, you've already got your health plan built, but you're unhappy with how much your employees are spending. You've got to control your cost. Our approach is, well, you don't have to go underwrite it again or wait till renewal, or just plug our tech into your health plan. and we can start connecting your employees immediately with a better experience. We can start bringing down the cost, making everything a better transaction across the board. And that's really been the start of Savvos. I call that incremental adoption, right? Like dip your
Yeah.
toe in the pool a little bit and let us show you that this immediate settlement model is going to change everything about not just the financial structure of your health plan, but also the experience and the satisfaction that your employees are having with the health plan. But from there, we launched earlier this year what we call Savvos Smart Pay, which is kind of jumping all in around a model of direct pay health benefits, right? So if you're a self-funded employer, you can build your health plan around the Savvos tech. This is a full vendor stack, fully underwritten, self-funded offering that employers can say, well, look, I just want to do better. I love that I've been working with Savvos, but I've still got this ridiculous health plan, this stupid network. I'm wasting all this money over here. So we now have a lot of employers that say, look, I want to kind of go all in on this model.
Yeah, okay.
I want, direct pay, immediate settlement for my doctor visits, for my pharmacy, for all of our medical procedures. So in that environment, Savvos, our tech, we sit as the program manager in a very modern, very exciting health plan design that is kind of taking the market by storm. There's tremendous interest right now in redesigning a self-funded health plan around a modern technology approach and not based on these old vendors. And again, I think there's a lot of good players across the space, but you've also, I'll just be really honest with you, there's a lot of apathy in healthcare. You've got a lot of middlemen in the transaction, whether it's,
Mhm.
like stop loss carriers, TPAs, PBMs, advisors. There's more acronyms in healthcare than any other industry, right? But the reality is when you talk about what are the greatest headwinds, at Savvos, we crash head on into a wall of middlemen that have built their business around the industry working as inefficiently as it does, and it's hard to get them to change.
Yeah, I'm
So
sure.
so that's where, I mean, because you look at the distribution in healthcare, it's through advisors, through TPAs, through stop loss and MGU carriers, and while I will admit that there are a lot of great innovative thinkers out there, I think to date still the vast majority are very antiquated and outdated. They're built on this claims processing model, and we crash into these guys hard,
I'm sure.
and that's where we run into most resistance. Providers want to change, employers want to change, and it's everybody in the middle that just becomes wall after wall after wall that we have to crash through to bring everybody together. So that's probably been the biggest frustration as we've gotten Savvos off the ground.
I'm sure it is. I'm sure it is. And I'm sure that will continue to be the case as well, Lucian. I'm sorry to say, but I'm sure there's a lot of those businesses who are, and that's likely the reason why they keep building on this old system, right? Because without it, their business kind of goes away, doesn't it? When you put Savos in front and center here, there's a lot of these peripheral businesses that aren't really adding any value, really speaking. No, not when you look at the system with Savos front and center. They don't really have a place in the system at that point. So I suppose for them, thinking beyond the current system and beyond the current process and thinking too far outside the box, they're kind of doing themselves out of a job, right? I think in a lot of these cases. Is that fair?
Well, certainly they're less relevant, right? And now don't get me wrong. I mean, we align really well with the advisor community, the TPA community. There
Yeah,
are
cool.
some great innovators out there, and for Savos, it's all about collaborative relationships. It's all about distribution at scale. So we do everything we can to work with. There's great TPAs out there, and we love them. There's great advisors out there. There's great MGU and stop loss. But I would tell you, I think they're the minority. I think so many that we've tried to work with, they're just kind of and I get it too. Like in their defense, there's kind of this fatigue. They're like, I'm already using 40 other solutions and none of them had worked. And so like people, I think there's this exhaustion where they're like, I've tried something, I've tried this. You're the 20th
Okay.
company in the last 5 years to come tell me you're different, right? So in their defense, I think they found something that works and they just kind of like dug in their heels and that's what they're doing. But the reality is we've got to like the in healthcare today, we're just optimizing dysfunction and we need to stop doing that. We need to build a better transaction.
Yeah, for sure, for sure. It reminds me of the banking system. I've paid a lot of attention to blockchain over the last few years, and I think if you know, not I think people smarter than me, if you look at that technology versus the current banking system that was designed in the 50s, I think it was, again, it can take 2 weeks for me to send money from here to Japan, right? In 2025, the whole system is so old and inefficient. But trying
Isn't
to
that
break,
funny? And it's because we're dealing with these highly regulated industries, right? And healthcare is the same way. Do you realize in healthcare, we're still mailing checks to providers. We're still faxing things. If you call a medical office, they'll say you need to fax me this.
really,
No, I mean it's like this industry is just built on these outdated processes that they're just having a real hard time changing, right? So with Savvos, we're simple, immediate settlement. It's like in 1985, if somebody showed up with Venmo. Do you remember what
yeah,
your life
yeah,
was like 30 years ago? Big
so
stacks of checkbooks and mailing money and waiting 5 days for it to clear. That's how healthcare operates today. Could you imagine 30 years ago if Venmo all of a sudden showed up and you could just immediately transfer money to each other? That's that. We're the Venmo of healthcare. Like we completely change the transaction and bring it into the modern era where we're still like, I'll talk to a health plan. They're like, yeah, today we're printing checks all afternoon to mail payment to these providers. I mean, I just can't believe what I
hard
hear
to
from these
believe.
companies.
That's hard to believe. It really is. But Lucian, I'm on the other side of the pond as we discussed. And for me, the whole idea when I heard this a few years back, that you go in for a surgery and you don't know how much that's going to cost. I mean, the stress and anxiety that would cause anybody is beyond, right? I mean, if you're living on the breadline and you go in and you have to go in for this critical surgery, life-changing surgery that means you can continue work or continue to live, who knows? To not know walking in that what that's going to cost, it blows my mind. It really
Yeah.
does. I
And
can't understand that. I really can't get my head around it.
so to control costs in the United States, we like put it on the consumers. Let's raise their out-of-pocket costs. Let's give them not $1,000 deductible, but a $5,000 deductible. Do you know the number one health plan that was sold in Utah last year was an $8,000 deductible for a single, $16,000 deductible for a family? You're spending $25,000 a year to have insurance and you're functionally uninsured. You're paying for everything, right? But we're not really saving any money because the issue is not how much I'm paying as a consumer. Somehow we're implying, well, consumers are overutilizing healthcare, so let's beat them up on the front end. That's not the problem in healthcare. It's inefficiency in the market on the back end where we're paying $120,000 for a total hip replacement that should be done for 15% of that price, right? So when we attack the root cause of the problem, everybody's talking about transparency and all these other issues in healthcare that like they're not realizing that the problem is the business model. Let's fix that and everything else kind of falls into place.
Absolutely. Absolutely, Lucian. And Lucian, if you look forward, let's say we look forward 12 months, maybe a bit ambitious, right? We look forward 2 years, 3 years, let's say 3 years. Savvos is an even greater success, right? You can see you guys are really taking off now and you've hit all your milestones in the next 3 years. And you're looking back at the last 3 years. What would be the moment what would be what would you be most proud of to have overcome in that time?
Oh boy, that's a great question. I think I think for us, certainly are like over the last year, everything has really changed for Savvos over the last year. I'd say 2025 becomes the defining year for this little tech company because we just we just kind of figured it out, right? We understand the markets where we have the greatest impact, right? High population areas with tremendous volatility in pricing, huge deltas between direct pay and network contracted rates. Like these are markets that really make sense for us, right? Like we understand our product offering. Like how do we really impact these self-funded employer groups? How can we really drive the greatest change in these market? Like so we've just matured as a company. We understand distribution, right? Like we try to align with existing stakeholders and like let's layer our tech across the distribution channel. And that's kind of been the last year for Savvos is, we built some great tech. You can have a great idea but not build a very good product, right? And so we had this great idea and it took us about a year or so to figure out, okay, how do we turn that into a really sellable product? And how do we align with the right markets? How do we align with distribution? And that's really been 2025. We know our markets. We understand distribution. Our product offering has really matured. So now for Savvos, it's all about like, where are we going to be in 3 years? Yeah, we hope to be supporting 1 million members in at least 5 key states and hitting some really exciting financial targets. But it all kind of came into focus in 2025 for us as a young technology company. But, to kind of tie back to the beginning of our conversation, you talk about, a $5 trillion industry. I mean, at Savvos, our goal is to be supporting close to 1 million members in 5 key markets. And the financial numbers are phenomenal. And we'll be there in 3 years. And Lloyd, we don't even show up on a radar screen.
Yeah.
We don't even really exist as a real competitor because the market's so massive. Does that make sense? Like when you look at
That makes perfect sense. Yeah.
when you look at these entrenched players like the large bucas and of course, federal programs and things like that, we could be supporting 1 million members and nobody even cares that we're here, right? So like that's the scope of the problem, right? So we welcome competition. I was talking to a young entrepreneurial group the other day and they were like, hey, if you want us to sign an NDA, and I was like, you guys, I know where we've come from. I know how much money we've spent. I know what a lift this is. If you guys can get here, come on, baby. Like go ahead, right? And the reality is like in the Utah area where we're headquartered, there's 3 or 4 other really cool healthcare tech companies. Over the last 2 years, guess how many times I've tripped over those companies out there doing business?
Yeah,
0.
I'm
The
sure.
market's so big, it's like, guys, go knock yourself out. Be as successful as you want. It's a $5 trillion industry.
Yeah, and that, I mean, the more of these successful companies that pop up, like Savvos, right? The more of a wave it starts making, then the more the word will spread. It'll feed you better, right?
Absolutely.
If there's a community of businesses that are doing this and suddenly they're popping up, it's going to make waves. It's going to help you get recognized and safe now, more powerful in numbers, I say, for sure.
I agree wholeheartedly.
Lucian, I've really enjoyed this conversation. I can see how passionate you are about what you do, and I'm sure you get a lot of fulfillment out of doing what you're doing as well. So thank you very much for joining today. I've thoroughly enjoyed it. It's very
Lloyd,
insightful. I genuinely wish you all the very best.
right back at you. This has been wonderful. I hope we stay in touch. Thank you for having me today.
Let's do that, Lucian. Appreciate it. Have a great
Okay,
day.
thanks so much.